Usec, ano pong plano sa testing, no? Dahil nga nagkakaubusan na ng mga testing kits, I know that you have allowed the use of antigen, pero yung DIY, hindi pa rin po yata pinapayagan. Will it ever come to a point where hindi na natin matatrack talaga yung real numbers, and if so, how risky, how dangerous could that be?
Well, we've come to that point where the value of testing is really for clinical management. Nung nauuna pong mga phases natin sa pandemya, napaka-importante because of surveillance purposes. We need to know who are positive, who are negative, so that we can be able to isolate, to quarantine them away from the population. Ngayon na ang dami nating kaso, transmission is ongoing and very, very fast transmission. Ang value na po ngayon ng testing is for clinical management. That's why we are shifting our policy, no? Pinag-uusapan na po with our experts that we should be able to prioritize our testing, no? Ang testing dapat, clinical management, i-prioritize natin yung mga vulnerable natin, senior citizens, those with comorbidities, yung mga immunocompromised, our healthcare workers. Aside from that, if it's for the community, we use antigen tests, especially if they are symptomatic or they are close contacts, we can use antigen. So ito po yung ngayong mga plano natin for us to do shifts in policy because ganito na po yung stage ng transmission sa ating bansa. And just to be clear, ma'am, our kits, we have sufficient stocks for now. Ang problema natin ngayon po would be the sudden increase in demand. Kung saan nagkakasakit din po ang laboratory personnel tapos biglang dagsa po ng kutakot-takot na tao, no? Na even those who are not part of the targets of our laboratories come to them. Kaya po talagang na-overwhelm yung sistema natin at nagkaganyan. Pero ang ating abiso, no, para lang sa ating mga community who are having mild and asymptomatic conditions, please isolate. Kahit wala pa kayong hawak na test, mag-isolate na ho tayo so that we can stop the transmission in the community.
Ma'am, clarify ko lang po, do you mean to say kanina when you spoke about the RT-PCR tests, do you mean to say that the government plans to regulate or limit RT-PCR testing to only the vulnerable and to healthcare workers just to make sure that we have enough for them to go around?
Yes, not really to limit, no, but we are going to prioritize. No? This is a shift in policy. And this is, of course, yet to be approved and consulted. Pero iyan na po yung pinag-uusapan ngayon with the experts. Because right now, if we try to see, ang dami na pong taong hindi nakaka-access sa serbisyo. At ang isang pinakatamaan po itong ganitong nangyayari sa atin ay yung vulnerable. Marami pong nakabinbin sa admissions kasi hindi sila makakuha ng test because nadidelay ang turnaround time. So how do we now try to address this problem? Magpa-prioritize muna po tayo hanggang sa umayos po uli ang ating sistema. And that is what we are thinking of, pinag-uusapan. Wala pa hong approval, but this would be the direction, no? Kung sakasakaling maaprubahan po tayo, this will be done, no? Hindi natin lilimitahan ang test for our community. We will have the antigen test sa ating komunidad. Meron na hong 2 suppliers and manufacturers na nag-apply for the self-administered test kits sa FDA. Ine-expedite yun ngayon.
Secretary Vince Dizon was quoted as saying na our testing capacity is at around 80,000 tests per day. I don't know if that's an accurate number, pero galing kay Secretary Dizon yun eh. Pero at the same time, when I looked at our testing in the past few days, we were hitting 77,000 tests eh. So we're almost at, assuming that's the correct number, yung 80,000, we're almost at the limit of our testing capacities and we're still getting higher. So I'm wondering lang, is there a reason to be concerned here?
We've reached 90,000+ during the Delta experience, and we only have added additional licensed laboratories already since the time that we had Delta. So our capacity more or less will reach 100,000 already. Kaya po natin. Sabi ko nga, testing kits, sufficient pa po as of now. Meron po tayong stocks ngayon eh. Yun lang po talagang choke po yung proseso natin because biglang dami, tapos nagkasakit po yung mga taong gumagawa.